Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical. It is Monday, December the 16th of 2024. We're blessed and open this morning and anxiously waiting for you to give us a call. Like I said, the last couple of weeks I've been working on trying to give everybody tips for calls. So we've got our text line, we've got a website, we've got a chat bot, we've got an email, we've got a regular telephone line with 4 or 5 people answering that phone. So we want to make sure you can get a hold of us. And so those are all the ways that you can contact us. And I want you to use any way you can to get a hold of us. The texting or the chat bot online are the easiest to do. And the number for that is 706-607-6685. Okay, so if you need that, you give us a call. So my clinical subject I'd like to talk to you about today is breathing medicines. So many people that we take care of here either have asthma or they have COPD or they've got kind of both. And COPD is more related to age and chronic issues, where asthma is more related to your allergic reaction to the environment and your sensitivity to or your lung sensitivity to the environment. The thing I want to talk about is when we do these, when we are evaluating people for COPD and asthma, there's 2 types of medicine that we use. We use maintenance inhalers and rescue inhalers. Everybody knows what the rescue inhalers are. That's your albuterol, basically, or used to be Convent, different things like that we'd use for rescue inhalers. And then you got your maintenance inhalers, okay? And the maintenance inhalers are like, the oldest one is Advair. You got Symbicort. Now you've got Trelegy and Breztri and all these other medicines. The thing I want to emphasize is if you're on one of those maintenance medicines for your asthma or your COPD, I want to encourage you to be diligent about using it on a daily basis. Like, don't skip this. The problem is there's some long-term consequences if you don't use those medicines just right. It strains your heart in a very unique way. And sometimes that's something that we have to deal with when you get older. And usually it's not a very comfortable place to be. It makes you, if you have what they call pulmonary hypertension, which not taking your inhalers and you got asthma or your COPD can cause pulmonary hypertension. It's a debilitating heart disease that makes it very difficult. It decreases your functional capacity tremendously if you get pulmonary hypertension. So the point today is, if you're on an inhaler for asthma or COPD, please use that inhaler diligently so that you don't get any problems with it. Plus, if you don't use it diligently, it can increase your risk of having pneumonia or having a COPD or an asthma exacerbation, which those are rough on your system as it is. But the additional thing is, if you do that long enough, you will have heart conditions that you have to deal with. So that's my clinical stuff today. It is the Christmas season. We had our Christmas party last night, which was wonderful. We will be open most of the time through the seasons. We're only going to plan on being closed on Christmas Day and New Year's Day. The rest of the time we'll have crews in here. We won't be at full capacity, but we'll certainly make room to take care of people who need immediate assistance. And remember, I'd really like to keep you out of the hospital, keep you out of trouble during this time. And if you call for help, we're going to try to help you as best we can, okay? And that number is 706-782-0016. So don't let things fester. Just a quick note, sometimes people tell me, I wanted to wait around a few days to see what happens. That's actually fine if you're a 20-year-old with a viral infection. You just got to be real careful if you're over 65. You can still do that a little bit, but you got to be very careful. And if things don't look like they're going the right way, you got to talk to us and maybe not wait as long to see what happens, because sometimes seeing what happens can be pretty rough. All right, this is Dr. Beck, LifePoint Medical. Love everybody. Give us a call if you need anything, and Merry Christmas.